Get started. Okay, so we're moving into a new unit, respiratory. This is, I think, a 2-lecture unit, and then we will do basically a lecture on each of the ones that you already have notes on. If you remember that you took digestive, excretory, and reproductive notes, you already have all those notes. So we will just talk about them. There will be a couple of things to do in Canvas with those, but not a lot. And then that's the end. It is now May. In fact, it is May the 4th. And so we will be done soon, actually. It's kind of crazy. At the end of the year, and then go to that point. Okay, so respiratory system, that's where we are. I've already posted the notes. If you do not have them, if you would like to, you can print them off. You don't have to, it's up to you. And we'll start. Sorry, I'm having to just really quickly upload something to YouTube. All right, so let me get going here. Let me share my screen. And we'll talk about a couple careers with the respiratory system, and then we will go on. Okay, moving you guys over here. All right, cool. All right, so here we go. Respiratory system. Careers. So here's the first one, okay? This is the first career you could do if the respiratory system interests you. These people are vital right now, especially dealing with the COVID-19. Their job is to identify and treat issues with respiration. So they help people with breathing problems, okay? Normally they're helping people with asthma, COPD, any of those types of issues. Currently, respiratory therapists are vital in helping those who have COVID-19. They can work in a clinic, they can work at a hospital, they can be a traveling respiratory therapist and travel to people's homes and help them. So a wide variety of things. You could be like a respiratory therapist, like aide basically, with just associates. But if you want to be a respiratory therapist, you do need to get a master's degree. And then coming out, you'll make about $60,000 a year, and then it's up from there depending on where you work and how much you work, basically. Okay? So respiratory therapists, that interests you. There that is. Okay. The second career is anesthesiologists. Okay. These people are responsible for your safety before, during, and after surgery. Okay. They are the ones that knock you out. They are the ones that will administer, if they're doing like a nerve block, where they will basically deaden, they don't actually deaden them, but they basically turn the nerves off for a specific portion of your body. That's done by an anesthesiologist. When you go in to have surgery, the anesthesiologist comes and talks to you beforehand. They are there for the whole surgery. They knock you out. They're also watching your vitals during the surgery, and then they make sure that you wake up from the anesthesiology normally. Okay. Excuse me. They are a medical doctor. Okay, so you do your 4 years of bachelor's, your 4 years of medical school, your internship, which is usually a year, 2 years, where you do a variety of different things, and then you do your residency in anesthesia, which is about 3 years. Okay, you will begin basically during your residency. You'll begin making about $250,000 a year, and then it's up from there. When you're done with your residency and you're a full-blown anesthesiologist, you will make more than that. Okay. My little sister and her husband are both in their internship, but they are both will be residents like in a couple months. I think they're almost done with their internship, but they're both doing residencies in anesthesiology in LA, and they're going to be rich one day. I tell my nieces and nephews those are the ones they want to suck up to, because they're the ones that will take them to Disneyland. But it's a great career. There is some malpractice insurance dealing with it, because you are in charge of making sure the person is not feeling pain and they stay knocked out during a surgery. You've maybe heard horror stories of people who were awake, but they were like paralyzed during surgery, so they could feel everything, but they couldn't. Those things do happen, but your job as an anesthesiologist is to make sure those things don't happen. Okay. All right, cool. Both those careers are great careers if there's something that interests you. We are now going to move into the respiratory system. We're going to talk about the functions and the anatomy of the respiratory system. We're going to go over the basic overview of the anatomy, and then we'll go about the specific parts. And then we'll talk about how you breathe and some conditions with the disorders with the respiratory system, and that's it. So let's begin with functions. Normally in class, we go over this, and I have you guys come up with ideas, but since we're not in class, this is what we will do. Okay, so functions, okay? Provide oxygen. Okay, that is one of the main things that your respiratory system does, is put oxygen in your body and get rid of carbon dioxide out of your body, okay? It does a variety of other things also, but those are the main two key things that without the ability to do that, you would die, okay? Doing those things actually helps to regulate your blood pH. So we talked about this a little bit, but we didn't go into great detail. We're going to talk about more of it today, or not, maybe today or next time. Your carbon dioxide is actually dissolved in your plasma, and then it travels through your body as plasma. So carbon dioxide is produced as a waste product for a variety of different chemical reactions happening with your metabolism, including the creation of ATP. Okay, cellular respiration, where your body makes ATP, one of the waste products is CO2. So your body's constantly making ATP, so you have a constant production of CO2 also. High levels of CO2 in your blood can affect your pH, your blood pH. And your blood needs to stay at about 7.35 to 7.45 pH level. If you have too much carbon dioxide, it can vary from that, which can cause organs to shut down, amongst a variety of other things. So removing carbon dioxide helps to regulate your blood pH levels. Also, when you are, it gets cold here in Utah, it's not currently cold, but it does get cold. When you breathe in cold air, especially when it's 0 degrees outside, that could definitely damage your lungs. So instead, your respiratory system, basically the track to get to your lungs, will actually warm the air so that it doesn't freeze your lungs. You also have the ability to humidify the air, which is adding liquid or adding water into the air to make it easier for your body to function. We'll talk more about that later. And then it also filters the air when you breathe in. If it's like super dusty, right, and you walk through it, when you breathe in, all that dust, you don't want that in your lungs. So your nasal cavity, your oral cavity, and your trachea, your throat and your trachea, which we'll talk about, they're all lined with some form of mucus that catches foreign things, whether that be dust or bacteria or whatever it may be. The goal is to prevent it from getting into the lungs, so it actually helps to filter the air as it enters in your body also. Now, two things a lot of people forget about with the respiratory system is that the respiratory system helps with smell, right? Which also in turn helps with taste. You remember we did the lab where you plugged your nose and ate the jelly beans and how different the taste was when you had your nose plugged versus not plugged. So it actually helps with smell. Your respiratory system brings in air for you to actually smell. And then it also produces sound. There's a really cool video, and we usually watch it in class, but we won't be able to. If you want to look it up, I don't know if you'll be able to find it. It's The Incredible Machine, the respiratory portion of it. And they show, if you know who Steven Tyler is, he's the lead singer of Aerosmith. If you don't know who they are, you need to look them up. They use technology basically to look at how his vocal cords and how his muscles in his neck and other things affect the sound that comes out of him. It's actually super cool. So if you have a chance, I'll try to find it and post it on a link for it on Canvas also. But if you have a chance to go to The Incredible Machine, and then it's the respiratory portion of it. It goes into smell and those things also. But it's pretty cool. They have him sing and then they put a camera down his throat and you can actually see his vocal cords working. It's pretty cool. So if you have a chance, you should go and look at that. Okay, so here are some functions. This is pretty much what your respiratory system does. They're key, most of them are key in your survival. Okay, anatomy. Let me go back to, I need to go to my screen now. All right, we have the respiratory system here, and eventually it will pop up. We're gonna label, I'm gonna color as we go. We'll see what happens here. Okay, so we're gonna start superior, we're gonna move inferiorly as we, sorry, as we move along the respiratory system here, okay? The respiratory system starts in your nasal and your oral cavities. I have to remember if I have them both labeled. Hold on just a second. Lost something. Okay. So we have your nasal cavity and your oral cavity. So your nasal cavity clearly is here through your nose. Right? Your oral cavity would be located here. But we have the nasal and your oral cavities. This is where air enters and leaves the body. So your nasal cavity and your oral cavity. Your nasal cavity, inside of your nasal cavity, you have the olfactory nerve, which determines your smell. Remember I was talking about that with the cranial nerves. And then also we have a lot of mucus being produced, snot, right, that helps to filter air as it comes in to your body. Okay, your oral cavity also have saliva, which helps to filter, and then we'll talk about the throat as we get to that point. Okay, so oral and nasal cavity, that's where stuff enters in. Moving downward, or backward, I guess we should say, we have the back of the throat. And there's actually 3 parts to the back of the throat, and that's why you can see I have B1, B2, and B3 right here. As a whole, the throat is called the pharynx. Okay, so as a whole, pharynx, that's your throat. Okay, but the throat is divided into 3 parts. The top part is the back of the nose, where the nose meets the throat. The middle part is where the mouth meets the throat, and then the last part is where the throat meets the next portion, or your vocal cords. So we have 3 sections to it. We have this portion at the top, and then we have the middle section where you're, and then we have the lower section. So we have B1, B2, and B3. Okay, B1, where the nose meets the throat, is called the nasopharynx. Naso's nose, pharynx is pharynx. These make sense if you think of them that way. Okay. B2, where the throat meets the mouth, is the oropharynx. Oro means mouth. Oral, right? And then the last portion where the throat meets the voice box is called the laryngopharynx. And where it's going to meet what's called the voice box or the larynx. Okay, so we have the pharynx, also known as our throat. Man. And 3 parts to it. Okay, moving downward, we have your voice box, also known as your larynx. And we're going to look at the larynx in depth in just a minute. And we'll look at the different parts of that in just a second on the next page. Okay, next, we have your trachea, okay? Your trachea, also known as your windpipe. And it has, it has some cool things about it. So your trachea, also known as your windpipe, located right here. It sits behind, like down your throat and just behind your sternum. your trachea has a unique anatomical feature to it. It has what's called, I can't remember the name of it right now, but it's cartilage. It's made out of hyaline cartilage. We know that hyaline cartilage has some give to it, but it also has structure, or gives structure, right? Like your nose or your ears, where you can move them, but you can't like smash them and make them stay smashed. So the trachea has C-shaped rings, and the C portion of it is anterior, and then the opening is posterior. But it has C-shaped rings that go all the way down. And if you look at this picture close enough, you can see it. I was going to see if I have another picture here to show you. You can see them here. Okay, you can see these C-shaped rings that move all the way down it. Okay, they're cartilaginous rings, they're cartilage rings, and they help to keep the trachea open. Okay, so if you were to smash your trachea, your windpipe, right, and close it off, you would die, right? No oxygen in, you'd have carbon dioxide build up in your blood, and you're not getting enough oxygen to your cells, you'll die. So these C-shaped rings of cartilage help to keep your trachea open, so that even like some force to the neck or whatever it may be, or when you lay down, for example, okay, if you were to lay down, you don't want your trachea to collapse. So it keeps the trachea open at all times. Okay, which is actually pretty cool. All right, moving downward. Ooh. Okay, our trachea branches into two branches. We can just begin to see them right here. Here's one and here's the other. Okay, these are called the bronchi. One of them is a bronchus. Together they are the bronchi. Oh, I did that wrong. This is D. That's my bad. So these are the bronchi. Individually, they are bronchus. You have a right bronchus and a left bronchus. But together they are bronchi. And they're the branches that come directly off of the trachea and actually insert into the lungs. Okay? So we have bronchi that go into the lungs. Each of those bronchi then divide into smaller tubes. Okay? The smaller tubes, just like we talked with like artery and arterial, these are bronchi or bronchus and bronchial. So the smaller tubes that these branch into are called bronchioles. And there's a ton of them, and there's a variety of sizes of bronchioles. Bronchioles branch and then branch again and then branch again and branch smaller and smaller as they move out from the bronchi. So all bronchioles are not the same size. You have your primary bronchioles, which are larger, and then it goes smaller and smaller and smaller as it moves out and spreads out throughout the entire lungs. Okay. Excuse me. Okay, you have a ton of bronchioles. I'll show you a little table here in just a second. And then on the end of all the bronchioles, my goodness, I'm sorry, you have sacs. They look like grapes, basically. These hollow sacs that look like grapes on the end of all the terminal bronchioles, okay? This one's trying to show you a picture of it, so we're going to go with it. But they look like grapes, basically, and they're located on the end of all of the terminal bronchioles, the end of bronchioles. We end up with, these are called alveoli or alveolus for one. I'm going to show you some pictures here of these. And this is where gas exchange actually happens, is in the alveoli. If you were to take out all your alveoli and lay them out, that would make up like almost half of a tennis court. So we've all seen a tennis court before. Think of how big that is. Just in your lungs. Take out all the alveoli, lay them out flat. It would be 1/3 to half of a tennis court. So here's a picture of some alveoli coming off of a bronchiole. So you see here's the bronchiole and then the alveoli. The alveoli are completely surrounded by capillary beds. Okay, so all the alveoli have tons and tons of capillaries located around them. The alveoli are made out of simple squamous, just like the capillaries are. So it only has to, oxygen and carbon dioxide only have to pass through 2 layers of cells in order to do gas exchange. And we'll talk about gas exchange in a little bit, okay? So here's alveoli, you can see them. Here's a zoomed in structure of alveoli. There's actually 2 kinds of alveolar cells. One of them that actually makes the alveoli and allows for gas exchange. You can see the capillaries, how many there are. And then you can maybe see these little yellow cells here. These are type 2 alveolar cells. And they produce something called surfactant, which is a chemical that prevents your, it basically makes it so that it's a smooth movement as your alveoli are expanding and contracting. This is just an interesting table. We're gonna look at it for just a second here. Hopefully you can see that. You have, this is gonna show you the diameter and how many of each of these different parts of the system that we've talked about so far. So you have one trachea, and it's anywhere from 15 to 22 millimeters thick, okay? So think about how big that is. I thought I had a measuring thing I was gonna show you. Okay, so it's not very big. 15 to 22 is not very big if I were to look at this, okay? It's only about, if you can see this, it's only about this thick around. So it's not very thick, right? Your trachea is not very big, okay? However, look at now your bronchi are even smaller. 10 to 22, you have 2 of them, okay? And then we go even smaller into the bronchioles. Your bronchioles can be less than 1 millimeter thick. 1 millimeter is literally like this big. Like you can't even like look at how small 1 millimeter is. Like if I were to show you this, 1 millimeter is from one line to the next. Like that's very, very small. And that's the whole diameter. That's the whole around, like that's how big it is. Like that's diameter. That's teeny, teeny, tiny, right? So they're very small. And then the alveoli you can see are even smaller. And look at the numbers that you have, okay? That's a lot of alveoli, okay? Which is just, it's just kind of crazy to think that all of that is located just in your lungs, which are composed in your thoracic cavity, right? It's kind of crazy. All right. Okay, a couple more things on here. We have your lungs, of course, which we all know that we have. Here are your lungs. You have 2 of them. We'll talk a little bit more about the structure of them in just a minute. Let's do H, lungs. Okay, and then we're gonna add one more here. We also have a muscle that sits across the bottom of your thoracic cavity. It separates your thoracic cavity from your abdominal cavity. Remember that from a long time ago. We'll look at your diaphragm, spelled diaphragm. It is a skeletal muscle. And it helps with breathing, and we'll talk about how it helps with breathing here when we talk about breathing. Your diaphragm's kind of a funky shaped muscle. It doesn't lay like flat like a lot of the muscles do. Something I can find a picture here. I'll find one for next time. But it actually is almost like a concave shape. So it starts at the bottom of your ribs, and then it actually moves up at like a circular motion. Okay. And then the last thing that we're going to label on here are what are called your intercostals. You have 2 layers of intercostals. Inter means between, costal is ribs. So these are the muscles that sit in between your ribs. You have an internal layer and an external layer. So you have internal intercostals and external intercostals. And you use one set to breathe in and the other set to breathe out, and we will talk about those. So internal and external intercostals. Excuse me. I have a variety of videos that I usually show, but I'm just going to post them on Canvas. I'll just put them all underneath the same, just like a page under the module with just the video, so you can go and watch them if you would like. I have one that walks through, I have a couple of them that walk through the anatomy where it actually shows you the anatomy of them, so you might want to go through those. All right, so this is the anatomy of the respiratory system. We're going to talk about a variety of these in more detail. A few of them we've talked about them as much as we will talk about them. Okay, so we are moving on to talk in depth about the larynx. Excuse me. You can see that there is a up-close picture here at the bottom of this page. Okay, this is the larynx, and then below is the trachea. Above it would be the pharynx. Okay, the two pictures here are showing looking at a bird's eye view, looking from the top down. Okay. And this also has a, I forgot to fix this before I print this. This true vocal cords is supposed to be its own line. F, G, E, F, G. Okay, so here they are. You can run down while I'm talking. We're gonna start with the glottis, and I'm gonna show you each of them. After we write them down, I'll go back and show you what they look like. The glottis is the actual opening to the trachea. So the glottis is where air actually passes from your throat, from your pharynx to your trachea. There's an actual slit opening. Okay, and then we have the epiglottis, which is a flap. A flap of tissue that closes over the glottis when we swallow. And like I said, we'll look at a picture of all these in just a second. We then have the, we then have the false vocal cords and the true vocal cords. False vocal cords are muscles. True vocal cords are cartilage. Okay, so false vocal cords help you to close your glottis when you're swallowing. So we have a couple of different things here that are closing when we're swallowing. These prevent food from getting into our lungs. Okay, so not only does the glottis close because of the vocal cord, the false vocal cords, but also another flap lies over the top of it to try to prevent any type of food or water from getting into your lungs. Excuse me. So the false vocal cords are the muscles that help close it. The true vocal cords are cartilage, and they vibrate as air passes over them, and that produces sound, just like a guitar string or a string of some form. As you vibrate it, it produces sound. Okay, we have the hyoid bone, which we have talked about in some depth already. We talked about how it's the only floating bone in the whole body, doesn't attach to any other bones, but it does it where the tongue attaches, and also the muscles of the neck. A lot of the muscles of the neck attach to the hyoid bone also. And then we have two other types of cartilage called thyroid cartilage and cricoid cartilage. Okay? Thyroid cartilage is also known as the Adam's apple. It is thicker in males, which actually reduces the sound of, or not reduces, but lowers the sound of their voice. Females do have thyroid cartilage, it's just smaller. The thyroid sits on top of the thyroid cartilage. So your thyroid cartilage is in your throat, and we'll look at a picture, like I said, in just a second, and the butterfly-shaped thyroid sits right on top of it. And then lastly, we have the cricoid cartilage, which is the border where the larynx attaches to the trachea. All right, let me show you the epiglottis first. This will work. Hold on just a second. I'll show you a little animation of the epiglottis because it's the best way to do it. The epiglottis, if we look really quickly, let me go back to here. The epiglottis It's kind of blurry, but the epiglottis is right here, where I just colored that pink color. Okay, and then it has the ability to flap down. So let me show you a little animation of the epiglottis. Maybe where to go. All right, so if we watch here, we're gonna look from a side view. Okay, here's the tongue, right? They're gonna be swallowing. You can see this flap right here. Okay, that is the epiglottis, and then you can see the pharynx here, or the larynx there, and the trachea. So when you swallow, the epiglottis closes over, and it's gonna push the food back to the tube back here, which is the esophagus. Okay, so the epiglottis closes over the larynx to prevent, you can see it's a flap there, it attaches to the hyoid bone, and it attaches, it will close over to prevent food from passing in. Okay, now sometimes you may be laughing or talking when you are eating, okay? And in that case, you all of a sudden start coughing and people say things went down the wrong tube. They literally went down the wrong tube. If you're gonna watch these particles right here, if this person was talking or laughing, the epiglottis is not going to be closed over properly, and the food will pass into the trachea, okay? Which will automatically, when food or particles of water or whatever it may be are sensed in the trachea, it automatically sends a message to the brain, and you will begin coughing immediately until, and you will continue to cough until the particles have been removed, okay? So that's how that works. All right, let me go back to this. Oh, we already went over those. Okay, so let's go back to this. Okay, so here's this picture. We're gonna look at these things now. So we have this picture right here. Like I said, we're looking straight down. The glottis is this hole here. This is the glottis, okay? When it's open, it looks like what I just colored. When it's closed, we have the other picture where you can see the glottis is closed. Okay, so this is the glottis. On both sides of the glottis, we have true vocal cords that sit directly right here. True vocal cords. Here are the true vocal cords. Okay, and then on either sides of the true vocal cords, we have false vocal cords that help to shut and close the glottis when we swallow. Okay, so the glottis opens and shuts. As you push air past the glottis, it vibrates. Vibrations cause sound. That's what produces sound. That's the glottis, true vocal cords and false vocal cords. You can also see the epiglottis is lined on the bottom there. Now, if we look at this as a whole, you can see the epiglottis and the hyoid bone at the top. Okay, you can see the thyrohyoid membrane. You don't need to know that. What you do need to know, you have the thyroid cartilage, which you can see right here and right here. It wraps around. This is also known as the Adam's apple. This is where the thyroid gland sits, right on top of here. You remember it was a butterfly shape, so it has the two wings that sit on the two sides of it. Okay, depending on how thick the thyroid cartilage depends on how low your voice is. So males have thicker thyroid cartilage, which makes it so their Adam's apple is visible from the outside, and it also lowers their voice. Females generally have thinner thyroid cartilage, not visible from the outside, and they tend to have a higher pitch voice. Okay, and then the other part was the cricoid cartilage, which is located right down here, and it's basically the attachment point for the larynx to the trachea. Okay, so that is the larynx in depth. If you have questions, make sure you ask them. Okay, we're going to talk about the anatomy of the lungs, and then we'll be done for today, and the next time we'll go through the physiology. Okay, so the lungs have 2 lobes, right? We already know that. I thought I had more pictures on there, but I do not. Okay, so let me go back to here. Okay, so we have two lobes, or sorry, not 2 lobes. We have two lungs. We have the right lung and we have the left lung. In general, people's lungs will start just basically a little bit below your clavicle, and then they end at the bottom of your ribs. So your lungs have, and you can see the shape of your lungs here. Oh, sorry. You can see that both of them kind of angle downward. That's the same angle that your ribs take. So they fit behind your ribs, okay? You can see that we have the right and left lungs. This is right, this is left, right? The right, oh, I did that wrong. This is right, this is left, sorry. Yeah, the right lung has 3 lobes. The left lung has 2 lobes. And you can see the left lung is shaped slightly different in the middle. Okay, the reason for that is where the heart sits. And we know the heart sits just slightly to the left. That's why when we put our hand on our heart, we cross and put your hand on your left-hand side, because the heart sits slightly to the left. So 3 lobes on one, 2 lobes on the other. In order to function normally, you need all 5 lobes. However, some people with like lung cancer or whatever, they can actually remove a lobe and you can still live. But doing things like exercise or things like that, well, you would need more to bring more oxygen, will be more difficult. Okay. So those are the lungs themselves. The lung themselves is just tissue. The main part that's important is the tubes inside. Okay. All right, the last 2 parts on here, visceral pleura and parietal pleura. You have 2 layers of tissue that surround the outside of the lungs, just like we had 2 layers of tissue that surround the outside of the heart. We had the parietal pericardium and the visceral pericardium. Pleura, anything pleural, pleura is lungs. So parietal pleura and visceral pleura, we're referring to the membranes that surround the outside of the lungs. The visceral pleura covers the outer surface of the lungs, so it basically sits directly on top of the lungs. The visceral pleura sits directly on top of the lungs. And the parietal pleura attaches the lungs to the thoracic cavity and to the diaphragm. So the parietal pleura attaches the lungs to the surrounding structures. Specifically the thoracic cavity, so the inside of the ribs, and then also to the diaphragm. Okay, so it kind of is similar to this. This picture here. Okay, this is what the pleural membrane looks like. It surrounds the lungs. Okay, and it sits right up against, and there's some in between those. There's fluid. Okay, pleural fluid. That's what it's called, and it helps with reducing friction and also allowing for well, it's really about reducing friction. That's the main thing. Okay, so that's pleura. Okay, we're gonna stop there for today. That's the anatomy of it all. Next time we will go over the physiology of it.